Back when I was in my medical training, I read a book, Rethinking Life and Death, written by Peter Singer. How many recognize the name Peter Singer? Chair of bioethics up at Princeton. In the book, he deals with the rising cost of healthcare, and one of the solutions he sets forward is that we should change the definition of human life so that humans are, quote, fully human until the 5th week of age. So if an infant is born with a severe disability, they're not fully human, so we could just have them put to sleep. He's reintroducing the idea of infanticide. And it's his argument is that it's far more cost-effective. It makes for a much more efficient practice of medicine if we don't have to take care of our kids with disabilities. His argument is then we can pull that money over here and invest it in kids that are much more gifted. And it makes for a much more effective and efficient culture. Well, at the end of my medical training, I had to give a grand rounds. This is in upstate New York. And it was a pretty liberal group, hardly the bastion of conservative thought. And I was rebutting Peter Singer. But I knew with that audience I couldn't start out with the assertion Peter Singer's wrong, and here's why. Because in the postmodern mind, they would be more upset about my moral judgment to Peter Singer than his infanticide. So instead I started out with the question, how did America reach a place in our history where one of our leading bioethicists could seriously propose infanticide to deal with the rising cost of health care?